Hello everyone, how are you? I hope that all of you are fine. Today I'm going to talk about one important topics for every medical professionals, that is how we can differentiate CT scan and MRI. I want to tell you that in CT scan the X-rays are used. That is, the X-ray tubes are used for getting CT scan image. In a CT scan, we can see this is the skull bone. The bones are white in CT scans, and subtissue differentiations are not that much good like an MRI. So if the bones are white, we can tell that this is a CT scan. Okay, now if you look at the MRI image, here you can see that this is an MRI of brain. Here we can see in the outer part the skull bones are black here. If we see that the bones are black, then we can tell that this is an MRI image. Here we can also see that the soft tissue differentiation, that is the white matter and gray matter differentiation, is very much clear than that of the CT scan. Here we can see this is the ventricles, and ventricles contain CSF. According to the sequences, the CSF can be black and also white. If we look at this scan, here we can see this is also an MRI, because here we can see this is the skull bones and bones are black here. Do not confuse with the fat outside the skull bone. These are the fat of the scalp. And there is also a small hyperintense area. This is due to the fat of the bone marrow in between the skull bones. So the cortical bone, that is the inner plate and the outer plate, those things are hardest structure, and those structures are black in MRI. Here we can see this is the ventricle, and inside the ventricle there is fluid, and as the fluid is bright, so we can tell that this is the T2 sequence of MRI. So main differentiating point between CT scan and MRI is, in MRI the bones are black, but in the CT scan we have already seen that the bones are white here. And again, one important thing, that in the CT scan the procedure is having some radiations, but in MRI there is no radiation, and the CT scan is easily available and it's done within a very short period. But for MRI a long time is required, and MRI is not available in many centers. So as the CT scan is widely available, so if the patient requires early intervention or management, in that case a CT scan is much more advised than that of the MRI. Thank you very much for watching my video. Please subscribe my channel if you want to get more important videos like this. Thank you very much.